Lung cancer is a leading cause of cancer-related deaths in the United States and around the world. Almost as many Americans die from lung cancer each year than those who die from prostate, breast, and colon cancer combined. It's hard to watch someone you love suffer due to this terrible disease because when I was in high school, I had to watch my grandmother suffer and die due to lung cancer, and it was a very, very hard thing to watch. I believe it is important to know about lung cancer because it's affecting more and more people each day. Longevity says that 433 people will die of lung cancer today. Today, I'm going to inform y'all about lung cancer and how it affects the individual's body, the causes, and ways to prevent from getting this incurable cancer. According to the Mayo Clinic, lung cancer is a type of cancer that begins in your lungs. Your lungs are the two spongy organs in your chest, and they take in oxygen when you inhale and release carbon dioxide when you exhale. Lung cancer typically doesn't show signs or symptoms in the early stages. The signs and symptoms truly start at the more advanced stages, and they're easier to see there. The symptoms include a new cough that won't go away, changes in that cough into like a chronic cough, or as they call it, smoker's cough, coughing up blood, even in very small amounts, shortness of breath, chest pain, wheezing, hoarseness, losing weight without trying, bone pain, and headaches. The main cause of lung cancer is smoking. However, lung cancer can occur in those who have been just exposed to secondhand smoke for extended amounts of time, as well as in people who have never smoked or haven't been exposed to secondhand smoke in a while or for very long periods of time. Because of this, there's really no cure or no clear cause to what lung cancer is and what causes it. The Mayo Clinic says doctors believe that lung cancer is caused by smoking because it damages the cells that are in the lungs, that line the lungs. When you inhale cigarette smoke, which is full of cancer-causing symptoms or substances, changes in the lung tissue begin almost immediately. At first, your body is able to repair the damaged cells, but with each repeated time of smoking and taking in those substances that cause cancer, it increases the damage, and it just gets worse and worse and worse. And over time, the damaged cells they can't get fixed, they can't get repaired, and that's when the cancer will develop, is just the prolonged exposure to all of this. Now that we understand what lung cancer is and what the symptoms are, let's talk about some treatment options. According to lungcancer.org, there are two types of lung cancers, and depending on which type you have, the symptoms options, they vary. One type is called non-small cell lung cancer, which accounts for about 85% of lung cancer. There are multiple stages associated with this type of cancer. You have in stage 1, the cancer is only in the lungs and it hasn't spread to the lymph nodes yet. In stage 2, the cancer has spread into the lungs and into the nearby lymph nodes. In stage 3, the cancer has spread to the lungs and into the lymph nodes in the middle part of the chest cavity. In stage 4, which is the most advanced stage of this lung cancer, it has spread to both lungs, to the fluid around the lungs, and to another part of the body, like the liver or another organ. Another type of cancer, or a lung cancer, is the small cell lung cancer. It affects only about 15% of the people who have it. It tends to grow very, very fast, faster than non-small cell lung cancer. There are only 2 different stages in this type. The first stage is called the limited stage, and this is cancer is just on one side of the chest. It involves the lungs and the lymph nodes in just that one side of the chest. And then in the second stage, which is called the extended stage, the cancer is spread to other regions of the chest cavity and other parts of the body. Many treatment options for non-small cell lung cancer include surgery and radiation, chemotherapy, and many others in combination or alone can be used to treat it. In stage 1 and stage 2 of non-small cell lung cancers, they are usually treated with surgery. Those types of surgeries include wedge resections, which removes just a small portion of the lung that has the cancer in it, and then a small region around it. You've got segmental resection, which is a very larger section that is removed, and the area around it. You've got a lobectomy, and that's when an entire lobe of your lung has been taken out. because it's all been affected with the cancer and then a small region around it. And then you've got the final one is a pseudomonectomy, and it is the removal of the entire lung that is affected. Another treatment option includes chemotherapy. Chemotherapy is the use of drugs to kill cancer cells. Chemo is usually used in combination of drugs, or used in a combination of drugs given in a series of treatments over time, over a period of weeks and months, that it gives your body time to recover from the chemotherapy, because these drugs, they do a work on your body. When you see somebody who's really, really tired, because they've got the cancer that they have, it's usually the chemo that's tearing them down. It's really making it hard for them to function and to have daily life. Another option is radiation, and that's the use of high-powered energy beams in a source like an X-ray machine or a photon machine to kill cancer cells. Radiation is usually used after surgery to kill any remaining cells if they didn't get it all out, to kill the rest of them. But in most cases, radiation is used first in an attempt to remove it without having surgery. And it's also used where they can't do surgery to remove it, so they're going to use radiation. A lot of people will see radiation paired with something else. It's paired a lot with surgery and with chemo. A lot of people use it with chemo. Even though there are so many ways to treat this cancer, there isn't just one option that will just cure it completely, because it is incurable. Lung cancer, although it isn't curable, there are ways to prevent from getting it. The first way I have seen that prevents lung cancer is just to quit smoking if you are, and then to not smoke if you're not smoking. Smoking is the leading cause of this cancer, so it's simple just to stop smoking or to not smoke. Simple as that, and that you remove yourself from the main cause of what it is. Another way to prevent is to avoid secondhand smoke. To stay away from smoking areas, to avoid being around people who are smoking. Prolonged exposure to secondhand smoke is another cause of lung cancer, and it's just easy to avoid. Just stay away from those people. Another way to prevent from getting lung cancer is to eat a diet that is full of fruits and vegetables, and to exercise. This is a way that prevents from getting almost any type of disease and illness that you have. So it should be like a staple for everybody's life. Everybody should be doing it. You should always eat healthy and exercise to just keep up your own self and your own immune system and just your body in general. Lung cancer can only be treated and not totally and completely cured, but it can be prevented because only you can prevent it. In conclusion, it is important to know that lung cancer may not be curable, but it is preventable. There are so many ways you can do in your daily life just to help prevent you from getting this disease. Today, I hope that you learn more about what lung cancer is and how it affects the body of the individual who has it, the causes of lung cancer, and ways to prevent from getting this disease. Thank you so much. Bye.